Welcome back to the Empowering Minds Mental Health Podcast. I am your host, Jennifer Moore, and today I'm really excited about today's guest, Dr. Bume. Her story is powerful. She started in dental surgery, but her own recovery journey 18 years ago led her into holistic healing. She works with people from all backgrounds and focuses on real, whole person healing, mind, body, spirit. She also hosts Your Sober Sweet Spot, and I can't wait for you all to hear this conversation. Welcome to the podcast.
You very much. Thank you, Jennifer.
All right. So, before we get into the podcast, can you tell us a little bit about who you are and the work that you do?
Okay, so my name is Dr. Olubunmi Aboaba. You can call me Bummy. Thank you. And yeah, I originally started off as a dental surgeon. I've been a dental surgeon for 40 years. It was a journey. It was a journey through from when I was very young. I never felt like I fitted in. I was always feeling like that kind of square peg in a round hole.
Mm-hmm.
Just didn't quite feel comfortable in myself, around other people, very shy. Came from a very disciplined family, Nigerian family. And if there's any Nigerians out there listening, it's discipline, discipline, discipline education. So it's very, very much, work hard, get your A's, do really well. So I was very much kind of like the bookworm. And if I
Mm-hmm.
didn't do well, then there'd be a telling off, there'd be beatings. It was not one of those where you could get a C or a B, you had to get an A. So I was very much scared of life. My dad said, "You're a black woman." And, I'm gonna look back now, we've forgiven each other. But you're a black woman in a white man's world, you have to work 10 times harder, 100 times harder. So I was very scared of
Mm-hmm.
the world before I even, got into high school. What is this world about? So for me, it was just not being comfortable with life, being comfortable with myself and who I was. And I remember that at the age of 12, my parents weren't big drinkers. They would drink on occasion, Christmases, birthdays, and my mother offered me for the very first time when I was 12, a little glass of martini as a toast, it's Christmas, here, have a
Mm-hmm.
little bit. And immediately I knew that was going to be my friend. Immediately. It was almost as though the clouds had parted, the sky turned blue. I felt confidence, that shyness went away, and immediately I knew that was going to be my medicine, whatever. It was just like that.
Mm-hmm.
Um, didn't particularly like the taste of it, but how it made me feel. So that always carried through over the years. And as I went to university, it was just it was something that was there in the background. I had to do my exams, had to do my studies, so I would never touch alcohol. But when I finished, it was always on the back of my mind all the time. I'm going to have that drink because it makes me feel really good. I could be somebody else in a crowd. I could be this confident person. So the outside just didn't match the inside, but I depended on it more and more. It was my best friend. That was the first thing I would go to. And it wasn't apparent. I was high functioning. As time went by, it was just my go-to. I could not function without, not physically, but mentally, I felt very uncomfortable if I hadn't had a drink. So it became more and more of a vicious circle. I ended up where I just couldn't stop. There was a point where I just could not stop drinking. Um, and even though it wasn't effective anymore, it wasn't working for me. I felt that scared little kid again. So that all came back. I was frightened of life, frightened of people, and I couldn't hide it anymore. So the outside was starting to match my inside, which
Mm-hmm.
was, this scared little kid. And anyway, the wheels finally came off, and it was just a journey of it was just one car crash after the other. I ended up in 7 rehabs in 7 years. By that time I got married, had children, God forbid, nothing happened. Um, and in 2008, I came out of my seventh rehab, and I knew that if I carried on, if I carried, I wouldn't have an eighth rehab, I'd be dead. Um, so I knew that certain things weren't working, like a fellowship wasn't working for me, the rehabs weren't working for me. And a friend of mine said, "Come and see this lady." And she's a shaman, she's a naturopath, she does kind of ancient wisdom. And I kind of laugh because I'm from the medical profession. So for
Mm-hmm.
me, I was like, well, what's that got to do with how's she going to help me? But she said, just keep an open mind and come and see this lady. And she did just lots of things I'd never expected would work, like healing, hands-on healing therapy, which is Reiki. She used various other modalities. And I would say in the sort of 2 or 3 sessions, I felt like everything was going to be okay. And I've never had that before. I have never had that knowing that I was going to be all right.
Mm-hmm.
Um, and it was just this deep, deep certainty, that could be God, if that for me is, it was almost omnipotent that, whatever happens, I was going through divorce, I was going through DUI proceedings, everything was being thrown at my professional bodies. And I just knew whatever happened, I was going to be okay. And after that, I just thought, right, what is this all about? This alternative types of healing. And that's how I got into it bit by bit by bit, you know, God willing, everything was okay. I was well looked after. Things worked out the way I didn't expect them to work out, but they worked out. And again, it's that certainty and that belief that I was going to be all right that
Mm-hmm.
just powered me right through, the years. And life just got better and better. The outside matched the inside without the alcohol. Um, the real Olubunmi was coming out, the one that wasn't scared anymore, the one
Mm-hmm.
that was allowed to grow, and be nurtured, and to be able to feel that self-love and compassion for myself, which I'd never had before. I was always beating myself up, criticizing myself, um, and on all of that. And eventually, bit by bit, those layers started to go of that self-worth, low self-worth, self-doubt. I'm not good enough. I'm not enough. I'm not clever enough. I'm not pretty enough. All that started to go bit by bit by bit by just doing this natural kind of work on myself. But the most important thing was this certainty that I developed. And it's beyond trust and it's beyond faith. It was this certainty that I was going to be okay, no matter what. Even if I was having a really bad day, I knew I was going to be all right. I just knew I was going to be okay. And it was a wonderful feeling to have. And that's what I always try and help my clients, people I know, is to develop that certainty that it's going to be okay. It might not look perfect, but that's how every day is a perfect day. And when I say every day is a perfect day, it might mean things come that we have to learn from,
Mm-hmm.
you know, lessons and blessings. It's all there. It was put there for a purpose. God put it there for a purpose,
Mm-hmm.
and that's how you learn. And when you start seeing life like that, every day is a perfect day. And it's there for us to learn and to build that certainty and build that trust.
Mm-hmm. Well, thank you for sharing your story. So it seems like 2008 was a turning point
Yeah.
in your life towards resilience. So
Yes.
moving forward, what does a typical morning routine look like for you now?
Right. So my morning routine is quite long. Um, but I never step out the door without talking to my creator. And I just put God first in everything. So I spend my time in the morning. Really, I get up, I have my lemon water with a bit of turmeric, a bit of, ginger, and have that. And I just sit in stillness. I sit in stillness and I'm just grateful. I'm grateful for my sleep. I'm grateful for my bed. I'm grateful for being able to wake up another day well, sober. I just thank God for the health of my kids. So I do all of that. That takes me some time. And then I do some grounding exercises, sort of visualize a white light around me, ground into the earth, ground to be feel really grounded, part of the earth in my body. Because a lot of the time I was not in my body when I was drinking, when I was going through all of that, that I just wasn't connected to me. You
Mm-hmm.
know, I'd rather be reading a book and watching a film and thinking I'm in that book or I'm in that film rather than being in my own body and being happy with that. So for me, it was about just getting grounded into my body, being present, being here, um, not flying off in my head somewhere. Um, I spent quite a bit of time and I still enjoy it. I just enjoy the grounding exercises, breath work, somatic exercises just to
Mm-hmm.
make sure, do some meditation. So I take my time. And then that day, then intentions for the day, I'll write some intentions out for the day. I'll visualize how, I would like the day to be. It's only a
Mm-hmm.
few minutes. And then I have my breakfast and I'm off. I'm ready and off I go. So that sets me, it's like having a very good breakfast.
Right.
That's what I do is that is my good breakfast in a way, to set me up for the day.
Okay. Your the lemon water, turmeric and ginger, that's some good stuff. I drink that in the mornings as well. And it really just kind of helps me with brain fog and stuff. Okay.
Um, and carry on like that.
Okay. I'm sorry. I don't know what happened. There was a brief silence, but I think we're okay
Oh,
now.
I carried on talking.
Okay. All right.
Yeah.
So,
Yeah, because you
well,
froze a little bit. So I thought, right, I'll just keep talking.
okay, got you. Sorry about that. Okay. So we're
That's
just
all
gonna
right.
continue to move forward. But I do love your morning routine. Our routines are
Oh,
kind of similar. I get up, I pray, I read my daily devotional, lemon water here or there. But every morning I do my ginger turmeric tea. That's some good stuff.
oh,
And
nice.
it really does. It helps me. I just feel more balanced. You know,
Yes.
our gut health is connected to our brain health, and that's very critical for me. So I do
Very
like your
important.
morning routine. Yeah.
Yeah, no,
So
that's important.
yeah. So what I wanted to ask you next, you were talking about your healing practices. So you blend ancient healing properties and practices with modern technology in your work, especially around
Mhm,
burnout and addiction. So
mhm.
why does that matter to you?
Because I believe when I got well through somebody working on me with energy healing. Now, which is the shame. And back in 2008, she used hand healing, she used Reiki. Reiki is about getting your life force to flow through your body more freely. I never believed any of it at all when I had it, but it's helping your life force flow through you so that your energy is not trapped. Um, you become more joyful, you become happier, you can face challenges more when your life force is thrown. I mean, if you think about things like reflexology, acupuncture, massage, that's all related. People who do Tai Chi, Qigong, that's helping the life force flow through your body better, kind of clear the blockages. So that's what that's all about. We have ancient systems in our body called meridians, which are acupuncture lines. And so I started to think, well, if this is getting me, if I'm feeling better quickly with this, what does that mean? And I kind of began to understood and began to read that our body is an energy system. Yeah.
Hmm.
So we have a life force, we have an energy system, we have an electromagnetic field. And now studies are showing when we're upset, when we're angry, when we're upset emotionally, that electromagnetic field changes. And sometimes if you're chronically upset or angry, it starts to form blockages.
Mm,
It starts to form blockages. And that's what acupuncture, massage, and all of that start to unblock these energy systems. So I thought, right, so we're kind of made of energy, you know, everything's made of matter, is made of energy. And what is energy? Energy is a vibration. So our bodies are very dense. So physically we vibrate. We're the energy body, very dense energy. And then we have these other lighter energies called the electromagnetic field, the aura. So I was understanding that as well, if we're energy and I'm feeling a lot better as this woman's worked on me, so it's my energy system that's not flowing right. So as soon as my energy system
mhm,
began to flow better, I started to feel better. And that's what clicked for me. It's like, okay, so let me study Reiki. Let me study, which is ancient. Let me study Reiki. Let me study the power of things like crystals, um, the power of imagination, that's energy. How we speak to ourselves, that's an energy. So our thoughts are energy, our we verbalize is energy. So I started to think, well, how we speak to ourselves an energy. If we
mhm,
speak well to ourselves, our body responds. If we speak badly to ourselves, we feel bad. If our
mhm,
thoughts are not great. So all of this started to tie into this is an energy, this is an energy, that's an energy. Um, so I started to kind of mold it all together. So things like Reiki, future life progression, and there are now technologies that produce frequencies to really help the body energy field restabilize, and it's called bioresonance. And there's bioresonance technology, there's quantum technology. So because I'm a bit of a geek, it all tied in for me that if this is going to help somebody recalibrate their energy field and help them feel better,
mhm,
that'll make them think better. It'll help them to look after themselves better, think better thoughts, ask healthier questions,
mhm,
and start to break it down. So it's a mind, body, spirit thing. So our energy field is connected to parts of our body, parts of our organs. So we have the chakras in Reiki, which are all connected to organs, the energy fields down the midline of our body. So I really started to look at how innovative technology can enhance things like Reiki, energy medicine. So that's where I went down that route. Obviously, it's mind, body, spirit. So there's counseling involved, so it's not just the spiritual energy thing, it's the counseling's involved. We're talking about the pillars of health, making sure that
mhm,
you're physically eating properly, you're drinking, you're hydrating,
mhm,
you're moving your body. Those are all very, very important. Then we look at the mental, what your relationship's like. Have you got a growth mindset? So all these sort of come into play. And then it's the energy work, which is finally that's very, very powerful, to be able to assist you, to be able to kind of have better habits, increase your resilience. So yeah, it's really powerful. It's technology that's coming into the fore now. It's starting to be talked about, which I'm really pleased about. But I always equated energy with well-being, your energetic
mhm,
body, your energy body. And if we can get our energy field coherent and circulating properly, everything else starts to fall into place. So you start to look after yourself better. You start to be able to employ more resilience techniques. Your mental
mhm.
health is better and it's healthier. You feel lighter. You may feel more joyful. So for me, it was just came hand it just came like that. They both worked really, really well.
So thank you for bringing awareness around this topic because I guess I never thought about massage and acupuncture as like a healing type of energy. Um,
Yeah.
so I was born with congenital fusions, and so I've always had a lot of problems with my neck, spine, and over time my muscles and different things. And so there was one point where I was having to take narcotics to manage the pain, but I really don't like medication, right? And so I started going to the chiropractor, and as an alternative, I started doing acupuncture
Hmm.
and massage. And I don't, it was like this immediate boost. Of course, the physical, but even mentally, I just felt better. But I just never thought about that being a practice of like healing hands. But even now, I try
Yeah.
to, yeah, the massage I try to make at least once a month. But I
Hmm.
just feel so much better. Like you say, like an overall wellness. It just like it wakes my body up. And I feel so
Yeah.
much better just having even mental clarity through that as well.
Exactly.
So thank you for
Exactly.
yeah, thank you for
Yeah.
touching
So
on
it's
that.
it's it's kind of like it's shifting the blocks of energy that are causing you the pain and the discomfort. So it's moving those, it's shifting them so that your energy can start circulating again. It's like a blood
Mm-hmm.
clot, when you have a blood clot in the heart or a blood clot in your legs, you feel pain. And it's the same with your energy system. If there's a clot in the energy system, then you're going to feel some discomfort, fibromyalgia, maybe
Mm,
mentally not very well. So it's about shifting the energy. It's like shifting blood and you actually shifting blood as well because you're massaging, but you're shifting the energy field so it can actually start flowing better.
mm-hmm. All right. So now I want to touch about the R4 method. You created this relationship, reframe, resilience, and recovery. Now, why does relationship come first?
I think relationship comes first. It definitely comes first because you have to start with self before you can go
Mm-hmm.
anywhere. So rather than, you know, saying you need to do this and doing that and doing that and blah, 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 and having a program, I kind of believe we have to go below that first of all. And it's who are you?
Mm-hmm.
Who are you? You know, how do you show up in the world? How do you feel about yourself? Like really, really get to really go under the cover because there could be layers of trauma there,
Mm-hmm.
you know? So I do not see the point of giving somebody a program and trying to help them until you understand and they understand and become aware of who they are, what are their beliefs, their values, what they're scared of, what triggers them. It could be low self-worth, they don't like
Mm-hmm.
themselves, maybe something happened. So we have to kind of just have a little, a gentle journey. And sometimes it has to go deeper, but a lot of people have, nervous systems that are just completely dysregulated through experiences in life.
Mm-hmm.
And you're not going to start any kind of healing if that is still the underlying issues. So, somebody come to me and say they want to lose weight or they want to stop drinking or that, but we have to really go and start finding about the person, and who they are. And this is a gentle journey. It's not, I'm going to give you 20 questions. It's exploring that and may take a few sessions to see what really, and they may not know.
Mm-hmm.
But it's getting them to have an awareness of themselves and who they are. And then that's when you can start to build why is your relationship then to your mental health, to drugs, to food, to
Mm-hmm.
gaming, to gambling. What is it that, maybe started this off and this is going backwards and not causing any more trauma, but being as gentle as possible.
Mm-hmm.
So we have very different parts. We have, it's when we don't like ourselves, there's parts of ourselves that we don't like,
Mm-hmm.
fragments of ourselves. There's parts of ourselves that we do like, but we kind of push away the bits that we don't like. But the bits
Mm-hmm.
that we don't like are the bits that we need to forgive, to love, to have compassion.
Mm-hmm.
So it's about, and this is what happened with me is I started to feel whole when I started to accept parts of myself that I was ashamed of or I felt guilty about.
Mm-hmm.
And bringing all those parts together, the child part, the adult part, the teacher part, the criticizing part, and we're going to start bringing all those back together bit by bit. That's when I felt whole. I
Mm-hmm.
could forgive every aspect of myself, and shed light onto those parts that I just really didn't want people to see. You know, if I wanted to show up in the world, I had to show up in the world as me, fully me,
Mm-hmm.
before other people can accept me, And in the end, I didn't really care who accepted me or not because I didn't need by that time other people's validation
Mm-hmm.
because, I just felt this is me, and it's still work in progress. It's not like, oh, it's a done job.
Yep.
We always have to be working on ourselves. It's a journey, but it gets easier, and there's days when it doesn't feel great. You've got the tools to help yourself, but always going back
Mm-hmm.
to love, going back to self-love, going back to self-compassion,
Mm-hmm.
giving ourselves an easy time. I always gave myself a hard time. And that again is a projection from my family upbringing that, I was given a hard time to do well. But that
Mm-hmm.
behavior from my family was only because of love. They loved me. They wanted me to excel,
Mm-hmm.
so they did it from a place of love, even though at the time it felt very harsh.
Mm-hmm.
Um, and me and my father, we love each other very much. And he said one day, I'm so sorry for, being so hard on you. But by that time, I'd done enough work to actually
Mm-hmm.
say I could see that his behavior was, how he was brought up, and that's how his grandma um
Mm-hmm.
worked with him. So it's always about just going back and investigating, getting curious about yourself, curious about life, and starting to have some fun with it.
Yeah. So
Yeah.
I love your answer because in my own personal journey, when I first started therapy, I I didn't want to talk about the root cause of why
Yeah.
I was doing some of the things I was doing or why I had done things previously. But once
Mm,
I got to the root cause, or I felt comfortable enough to talk about it, it did stem back to some childhood things. And yet my mother was very academically, she was very, very hard on me. So I started being very self-critical of myself
mm,
as early as probably like 7 or 8 years old. But as I got older, I forgave her because I had to think about it. This is probably how my grandmother and grandfather were to her. For them to, it was like 14 of them. So they were pushed, to do their very best too.
yeah.
But again, like you say too, I like the part, and I tell people the same thing. Recovery does not mean, oh, whatever situation you're going through, it's over. It's not. It's something that I have to practice certain things like
Mm,
every day. And
yeah.
that's just how it's going to be the rest of my life in order for me to be well all the way around. So I'm so glad that you did
100%.
mention that because there is a
Yeah.
misconception when people say I'm in, I've recovered. They think the issues ended, and that's not the case. You just
Mm.
kind of use those skills you've learned and keep building to keep
This is
yourself
it.
healthy.
It's having, as you said, it's having that toolbox, isn't it?
Mm-hmm.
And it's a journey. We never get to the end of any journey. We never get to
Mm-hmm.
even, the end of our lives. We're still growing, we're still learning,
Mm-hmm.
we with everything. So, for someone to say I've recovered, then it's kind of a bit misleading, because there
Mm-hmm.
will be things that will come up again that will test that person,
Yep.
and to use the tool. So it's a never-ending journey, and I'm absolutely okay with that,
Yep.
you know. because it's a journey of curiosity. It's a journey of, you're evolving. You haven't stood still. You're
Mm-hmm.
still moving forward. You're still starting to enjoy life more. There's lots of, things you could be grateful for, and for me, that's happiness. Happiness is evolving, is is being able to kind of enjoy life as it is,
Mm-hmm.
you know, as you see it today, to be able to enjoy it. Some people might go, well, why do you find that? I said, because number one, I'm alive. Number two, this is how this is perfectly, my life is perfect today. Your life is perfect today. The obstacles that
Mm-hmm.
you're going through, that's perfect for you to learn. The blessings that you have in your life, that's perfect too.
Mm-hmm.
So that's how I see life. It's that it's a journey.
Absolutely. Speaking of journey, my next question, because you've mentioned about recovery and things, and so can you walk us through your journey with addiction and recovery and what rock bottom really looked like for you?
Mm. Um, Rock bottom was when all the wheels were falling off. So the big pretense, oh, she's so confident, she's
Mm-hmm.
really kind of articulate, she's on the top of her thing. Look at her marriage, beautiful kids, nobody, and I was a high functioning alcoholic, so I wasn't until the end, until the wheels went off. And it's when people then started to see the real me, which I didn't want people to see,
Mm-hmm.
and they're seeing, which was again a falsehood, but it's like that there's the seeing this weak woman. And as a black woman, I felt very disgusted with myself that
Mm-hmm.
I'd I thought I'd let the sisterhood down as a strong black woman. And then in the end, I knew that that was the very thing that was stopping me getting well.
Mm-hmm.
Not being vulnerable, being, standoffish, I'm
Mm-hmm.
fine. I was helping everybody else, but I was okay because I didn't want to show weakness. And
Mm-hmm.
in fact, as I said, it was the very thing that really was my demise. I would not ask for help, then I would just break down. And then the rock bottom was seeing my youngest, they can't remember it now, they're in their 20s now.
Mm-hmm.
But my youngest saying to me, Mummy, why have you got a bottle, an alcohol bottle under your bed? And I was absolutely mortified. And he looked at me and I couldn't explain to him. And
Mm-hmm.
the worst thing that happened is when he left, I took that bottle and I drank. So nothing would stop me. Nothing. Not seeing the look on my son's face, not thinking they could die in a car crash because of my driving. Nothing stopped me. And that's so dangerous.
Mm-hmm.
So dangerous that you just everything you would lose everything willingly to have that drink in your hand.
Mm-hmm.
That is when everything just went, everything. Um, and just knowing how dangerous you would do anything. And when you see, that you're happening, maybe some people are listening now, they've seen family members go to the limits to get their drugs, steal,
Mm-hmm.
lie, manipulate. It's not them, it's the addicts.
Yep.
And it's with the neuroscience, and neuroscience proves it as well, that it goes beyond the brain changes
Mm-hmm.
neuroplasticity. So with neuroscience, it goes from, oh, I like a drink, to I need that drink. And
Mm-hmm.
your physiology, your psychology, nothing will stop you. You will go to the ends of the earth. And
Mm-hmm.
I went through that. This is someone who had discipline, somebody who had intelligence. It didn't matter. It doesn't matter. It doesn't
Mm-hmm.
matter whether you're a doctor, whether you're a shopkeeper, anything. Once you pass that boundary, that border, you're in territory where you have no control.
Mm-hmm.
You have no control. So people, please, if have So, and people say, oh, well, he did it to himself, she did it to herself, it's
Mm-hmm.
their fault, they're weak-willed, and it's nothing to do with willpower. Willpower, there's no such thing as willpower in addiction. You cannot
Mm-mm.
stop. It's a compulsion. It's a compulsion. You are almost, it's almost like you've got, it's almost like if somebody had a knife you'd stab it, you know what I mean? It's that addictive that you would just like, even if you got stabbed or something, you still want to go for that drink or that drug because
Mm-hmm.
your brain is wanting to calm down.
Mm-hmm.
The neuroscience of it is the brain wants normality again. And
Mm-hmm.
normality is having that drink, having that drug to feel normal again,
Mm-hmm.
you know? And that's what it's all about. So when people really kind of get to understand the neuroscience of what addiction is all about, they'll start to have more compassion for the person. I'm not saying that
Mm-hmm.
the behaviors are great, the behavior's rubbish, but the person isn't doing that out of sheer bloody mindedness. It's
Mm-hmm.
because they are now, you're looking at the addict, you know,
Right.
you're looking at the addict, you're not looking at the person.
Mm-hmm. And I'm glad you said that too, because I've been in mental health, I think this is my 22nd year. And sometimes with families, they might say, I wish John would just stop drinking or whatever substance or whatever it is they're addicted to. And I had to really explain to them, this is a disease. They can't turn
Mm,
it, they can't turn it on and off. Their
mm,
mind is and their judgment is cloudy. And
mm,
so once you kind of, or for me personally, once I started kind of educating them around this is not something that they can control, because if they could control it, they would have stopped a
they
long
would.
time ago.
Yeah.
That was able to kind of help the family understand a little bit better, like maybe offering uh, extra support, just being more in
Mm,
a supportive role than being in more of a critical role.
yeah.
So I'm glad that you did shed light around that. And
Yeah.
so we've
It's
talked about,
difficult. I mean, it's not easy. It's not easy,
no, mm-mm,
and when, the families see, certain behaviors, certain things, it's very difficult to have compassion. But if people
mm-hmm,
really understood what happens in the brain when addiction really takes off, they
mm-hmm,
would have a much better understanding
yeah,
for the person.
mm-hmm, absolutely. And so we've talked about a lot, but I do want to go back to your 18-year-old self. So if you could go back to that age, what is one piece of advice that you would give to yourself?
Going back to my 18-year-old, I would say you're good enough as you are.
Mm-hmm,
You're good enough as you are. You don't need to change. You just need to be you. Nothing to be ashamed of.
mm-hmm,
Just be you. And even if that means you look a bit frightened sometimes or a bit scared, a bit vulnerable, just be you. Because I tried so hard, even from that time, 18, just to be this other person that people would like rather than just being myself. So, and I say that to my boys. I say, just be yourself. Just be yourself. You've got nothing to prove to anybody.
that resonates with me very much so. Our
Yeah.
our stories are almost similar. Uh, Again, I began being very self-critical of myself as early as elementary school. And so I always knew that I was different than my friends, but I wanted to fit in. So
Mm,
I created this, let me create uh this image of myself where people will, I want them to like me. I don't
yeah.
want to be like the oddball. And so
Yeah.
over time, I developed an imposter syndrome. And I just learned a
Yeah.
lot about this within the last year. And as I'm listening to this teaching, I'm like, that's exactly what I did because I wanted to fit in. And
Yeah.
so, yeah, I would give my 18-year-old self the exact same advice. I really would. So thank you for
Yeah.
highlighting on that.
Well,
Yeah. And so my
it's
last
it's
question.
such and it's such
Oh,
hard work being trying to be something that you're not
yep.
and then hiding it either through, I don't know, drugs, alcohol,
Yep.
just your mental health goes down, but you still think, I'm just going to maintain this persona because this is what everybody likes. And in all honesty, people
Hmm.
couldn't give a crap, you know. If you're yourself, they wouldn't even notice, and you're spending so much time and energy,
Hmm.
you know.
That
And
is
being
so true.
yourself is so freeing. It's just so good just to be yourself.
Yeah. I learned that the hard way. I feel better now that I accept myself. Like I'm very introverted. Uh, I'm into like golf and different things, and my friends are they're not into that kind of stuff. So they're like, she always wants, to them it's like it's weird that I want to, play golf and I really know the game or I read certain books or whatever,. But I'm okay with that.
Yeah,
And
that's
so
fine.
yeah.
That's
And so
great. Just be
the
you.
yes, the hiding really did it caused a lot of hurt for me long term. I mean, and I'm not promoting any type of substance abuse, but I was hiding behind so much trauma and depression that I kept a cooler in my car
Mm,
full of ice, and I think it was Smirnoff. And during the workday, I would just get me a cup and I would just go to my car and put it with ice, fill it with a Smirnoff, and go back to my desk, literally drinking
mm,
on the clock. So
yeah.
then uh, I started using a substance, marijuana. I'm late 20s, like 28, 29.
Mm,
Now that I look at it, I know that wasn't effective, but at the time, I thought it was. That was my coping mechanism to deal with everything I was dealing with as far as traumas from even from childhood and uh, adulthood. And so I'm very glad you highlighted on that part about coming out of hiding and just
mm,
be comfortable in who you are. It does take time.
yeah.
It's not an
It
overnight
is.
thing, but
And that's what I say to people is that, people do adopt those certain habits because they
hmm
only just want to, they're just trying to be normal,
hmm
you know? So it's a way of trying to feel like you fit in, that you feel normal
yeah.
because without it, you don't feel normal, you don't feel part of anything.
hmm
But it's kind of an adaptive thing. So it's not, in a way, it helped you cope with who you were. It helped
Yeah.
me cope with who I was,
hmm
having the alcohol, having the drink there. It helped me feel comfortable with me so I could fit into society. And
hmm
without it, I did not feel like I could fit in. So it's a coping mechanism, for an
Yeah.
underlying issue that you've not, you've been either difficult to verbalize,
hmm
understand, cope with. And so this is another coping mechanism. So people might can
Yeah.
think, what? But addiction was a coping mechanism for something that I could not um, manage within myself.
Gotcha. Okay. So again, I want to thank you for coming on to the podcast and sharing your story. And part of my mission with the podcast is to empower, encourage, and inspire. And that's what you have done today, sharing your story, because I always want people
Thank
to
you.
know that there is such thing as resilience, there is such thing as recovery, but you might just have to keep working on it. But it is
Yes.
possible. And so you've shown that today. And so before we log off, I didn't know if you've written any books that you might want to talk about, or if you have any resonating thoughts that you would like to leave with the viewers who will watch this later.
Yeah. Well, there's a couple of books that I've written. The one that I wrote it was about a year and a half ago, a couple of years ago. It's called The Invitation,
Mhm.
and it's Olubunmi Aboaba, and it's just about the little things, the toolkit that I used to get well. and it's possible. And then the other one, because my also big issue was around food. So I was a food addict. So I was a food addict before I drank.
Mhm.
So I had a real addiction to processed foods and binging. So I've written a book called Craving Freedom, and that's the R4 method to overcoming food addiction. So I'm using the R4 method there for people who have binge eating disorder, food
Mhm.
addiction, emotional eating, because that was a big one for me. And it's funny how alcohol and food addiction go hand in hand. You'll find people who binge eat also probably have an alcohol problem.
Mm.
So it's kind of codependent, co-occurring. So that very much was my first love was food. Then I found alcohol. Then when and then when I got into sobriety, it was back to the food again.
Mm.
And then I realized this is my coping mechanism, food, comfort. And so I managed then to really kind of heal myself from both of them. And also it kind of goes into if you're not careful, you have to, it's quite funny, addiction's weird because it can go into workaholism and then you burn
Oh.
out. It can go,
Mm-hmm.
yeah, workaholism. It can go into obsessing about things or gambling. So it can go this way, that way. So it's always looking at the underlying, you know, what's happening with you. But addiction is very much, it can go into something else and into something else. So, it
Mm-hmm.
got quite funny in the end because, I'd start obsessing about magazines and I'd see a feature in a magazine, then I'd buy another magazine to see if that feature was the same with that magazine. It was crazy, absolutely crazy.
Mm-hmm.
Then I started to laugh and I thought, that is again my addictive, obsessive tendencies. So recognizing it, I think, is very important.
Mm-hmm.
It can go in different avenues. So it's always good to be aware and to watch out.
Mm-hmm. All right.
Yeah.
Yeah. This has been a good podcast. And again, I thank you so much for agreeing to come on and fitting me in
Thank
with your
you.
busy schedule. So I thank you so much. And so I will be in contact with you soon. But again, thank you for coming on to the Empowering Minds Mental Health Podcast.
Oh, thank you, Jennifer, for having me. Yeah, thank you very
Mhm.
much. It was a pleasure.
Thank you. Take care.
And you.
Bye.